Goeiedag, good day. This is Liz Gutierrez speaking. We decided this year to do a personal video just to summarize the emails that I'm sending out and just hopefully make it a more personal experience for you. So ek hoop julle luister graag na die ou videoetjie en dat julle saam met dit na die e-pos sal kyk wat ek vir julle stuur oor die voordele wat verander en die bydrae wat verhoog vir 2022. I have the email in front of me, so I'll be reverting my eyes to that every now and then. So the most important thing is in the email I have two attachments. One is the summary of changes, opsomming van verandering volgens jou opsie Flexivet 1, 2, 3 of 4 en die brochure is ook aangeheg. The full brochure with all the benefits, and these because it's sometimes intimidating to have such a big brochure. If you just scroll down in the email, I have given you page numbers with specific benefits where you can have a quick look up. The document itself is really user-friendly, and you can just click on the little tabs at the top to get to a specific subject of concern or information that you require. So the first good news is that your premium will not increase on the 1st of January. Premie verhoog nie 1 Januarie nie, maar wat? It will increase on the 1st of April. The average premium increase is 5.5% if you take it from January to December, but the full effect of the average increase that you will feel in your pocket averages 7.4%. You can refer to pages 7 and 35 of the Fedhealth brochure attached to have a look at those premiums and the illustrations of what it can cost you. Then the summary of changes document takes each plan on its own, and it just gives a little summary of things that you can look at that are changing or increasing. One of the important pieces of information showing from Flexivet 2, 3 and 4 is that there are some hospitals that you must not use, otherwise there will be a big co-payment, and they are given in that document exactly which hospitals they are. In a life-threatening condition, lewensgevaarlike omstandighede, of course you use the closest hospital, and there should not be a penalty as long as the final diagnosis prove it was a life-threatening condition. So let op na die hospitale wat nie ten volle gedek is nie. Maak nie saak op watter opsie jy is nie, kyk net daarna. Okay, then with regards to your day-to-day benefits and the vault, MediVault is still there. So quick explanation, you have two choices. You can have the option like you used to have it in the past, where it already has a savings, it's one premium, it's the money for the year, and from January to December the premium will stay the same. Or you can choose how much savings you would like to take. So if you have a look at pages 36 to 39, each plan, and depending whether you're a single person or in a family or just two people, has a certain rand amount you can lend from the vault. Whatever you choose you want to use for the year, say 4,000 rand, it will transfer to the wallet. As soon as it transfers to the wallet, it's like money in your pocket and you can use it. And because of that, you will pay an extra premium for 12 months to pay back that 4,000 rand. So you can just have a look and refer. If you don't understand, then you can come back to it. I've also explained in this email, again, like I did last year, how the fixed option works for your day-to-day. Remembering GPs, most medical aid want you to use specific doctors in order to avoid co-payments. So on your Flexivet 1, 2 and 3, we asked you last year already to nominate specific GPs from the Fedhealth list, and it gets noted on your file. And once you have spent all your savings, gone through the self-payment gap, and you reach the threshold benefit, then you have unlimited GP visits with the GP you nominated. Most of you don't get through the threshold, most of you through the self-payment gap, apologies, but you don't get into the threshold, so you don't use the benefit. So it all just depends on how much you're going to spend on your day-to-day during the year. Flexivet 4, has unlimited GP visits from the start, whether it's from the savings, in the self-payment gap, or in the threshold, and it must just be preferably one of the doctors on the list. Fedhealth has a back and neck program and a hip and knee program that are very important. You use the correct providers, follow the correct procedures to avoid large co-payments. Cataract also makes use of specific hospitals. From 2022, there are a list of day clinics that you now have to use for day procedures. And of course, on the grid and elect options, if you choose one of those options where you pay less because you're always using specific hospitals anyway, you must also make sure that you use the correct hospitals for 2022 to avoid large co-payments or penalties. In the summary of changes attached, once again, the mention of hospitals, no matter which option you're on, that will no longer be paid in full, are mentioned, and there's a penalty of 7,300 if you don't stick to those hospitals. Referring to the brochure, in the email you'll see from page 12, I tell you about the Fedhealth app, the TOOP, that you can use to get all your information, see how much benefits you have left, and there's also an AVO shopping discount benefit that you can look into. Page 13 explains the FlexiFed structure. So where do you want to be? Do you just want the hospital? Do you want the hospital a little bit more day to day? If you have hip, knee, back and neck issues, you need to be on FlexiFed 4. On page 15, they talk about which procedures are to be done in day clinics. Remember, I said there are specific day clinics you need to use. Now on page 15, it's which procedures need to be done in those day clinics. Page 16 talks about the chronic cover. Each benefit has its own conditions that are covered. Make sure you understand what is covered and what not, and ask the questions now while you have the option to change. Page 17 refers to the wellness programs. There are benefits like hospital at home if you are ill enough to be in hospital, but they can organize for you to be treated at home. It's something that can be motivated for. There's a mental health program, back and neck, weight management, pediatric IQ, and diabetes. So it's programs, if you have any of these conditions, where you can register for, and they give you guidance and also can help you obviously to use your benefits correctly. Page 18 is screening benefits. Take note of what benefits are available at what age, and Fedhealth pays for them. It doesn't come from the day to day. Page 19 to 20 is the cancer benefits. Very important to take note of how your cancer is covered. For example, on FlexiFed 1, which is basically more a hospital plan for the young and healthy, cancer is only covered as a PMB benefit. So what that basically means, it will only cover the cancer if you qualify like you would in a government hospital, and if the medication is what you would get in a government hospital. Page 21 is maternity benefits. Page 22, mental health benefits. Page 23 to 24, your COVID basket of care if you should have COVID. Page 25 to 26 is your day-to-day benefits, as well as page 36. Make sure you understand where there are limits and where there are no specific benefits, and what is subject to your savings and what would be in the threshold. In a self-payment gap, you usually pay for everything yourself. Page 27 to 31 is some additional information on benefits you have. A nice benefit's the Medi Taxi. If you're in a certain metro areas and you don't have somebody to come pick you up, they will organize the taxi for you. And in certain situations, you can upgrade your plan during the year, but it's according to certain rules, and they are quite strict on that. Page 29, as in-hospital benefits, please. There are limits, there are co-payments. Some things are only PMB, some things are not covered. It's stipulated in the brochure. Have a look before you go for an operation during the year. Let us know, send us the information, send us the authorization, so that we can have a look and warn you or advise you if need be. Page 34 refers to the self-payment gap, which I'm talking about. So once you've used up your savings, you're in a thing called a self-payment gap. The self-payment gap is where you pay yourself. You send the proof into Fedhealth. They add it together Not all claims they approve of. So if they do approve of the claim that you paid out of pocket, they accumulate it to the threshold, which means they close the gap with those benefits. It is stipulated in your brochure very clearly what accumulates and what does not. Then I've also just put in the email with FlexiFed 1, 2, and 3 what your benefits would be if you did reach the threshold, as well as FlexiFed 4. And then on page 36, a bit more about the Vault to Wallet benefit. Please, if you have any questions, ask, email us during the year. Anything in your circumstances change, let us know. Email is always better, especially to Leandri and to Rihanna specifically. I'm not always in front of the laptop. If you want a quick service, please email them. If you want to, you're welcome to email us. We often do ask for email as well because we always need more information. Hoping you're finding this video a bit helpful. Let me know. And may the rest of 2021 be a good and a healthy year to you all. Have a great day further. Bye-bye.